Hi, I'm Whitney Morgan, Hashimoto's coach, functional nutrition practitioner, and creator of the Thyroid Reboot Method. This video is another installment in my new series where I answer the most common thyroid questions. So if you missed previous videos, make sure you go back and check those out. The question I'll be answering today is which hypothyroidism medication is best? But before I jump into it, go ahead and hit that subscribe button and the little bell next to it so you'll get notified every time I post a new video. I've worked with dozens of women with Hashimoto's and hypothyroidism. And time again, questions about medication always come up. But before I share my take on the topic of thyroid medication, I want to be clear that the information I provide is for educational purposes only and should not be taken as medical advice. Please discuss your medication options with your prescribing physician. So the symptoms of hypothyroidism can be pretty severe and quite debilitating. So we're very fortunate that we have several different options when it comes to thyroid medication. But which medication is the best and most effective? Well, like most important health questions, the answer isn't the same for everyone. So let's review your basic options, and I'll share the pros and cons as I see them for each one. There's three basic options. The first being levothyroxine, also known under the brand name of synthroid. This is by far the most commonly prescribed medication for hypothyroidism. It is a T4 only medication and works by supplementing this specific thyroid hormone in the body. And if you've watched any of my previous educational videos, you know that the majority of the hormone that the thyroid produces is T4. However, T4 needs to be converted into T3 in order to get into your cells and make you feel better. Okay, so what are the pros for levothyroxine or synthroid? First, it's readily available. Second, it's usually covered by insurance. And third, it's reliably gluten-free. But there's also a few cons, in my opinion. The first being that not everyone gets symptom relief from a T4 only medication. Second, although synthroid is reliably gluten-free, the generic versions of synthroid may not be. And the third con is that both synthroid and the generic versions of synthroid contain corn. All right, let's move on to the second medication, which is liothyronine, also known by the brand name of cytomel. This medication is a T3 only medication and has been found in some cases to be more effective at symptom relief than levothyroxine or synthroid. So some of the pros for this medication are it's readily available, it's also typically covered by insurance, the brand name version, in other words cytomel, is reliably gluten-free, and like I said, it tends to have a better track record for providing symptom relief than the T4 only medication. But there's a few drawbacks to this medication as well. First, fewer doctors prescribe cytomel as an initial treatment, relying instead on a T4 only medication. Unfortunately, this often leads to delays in symptom relief. And like I already mentioned, generic versions of cytomel may not be reliably gluten-free, and also both the brand name of cytomel and its generic versions contain corn. Are you on a thyroid medication but you're not getting adequate symptom relief? If so, share your experience in the comments. Another alternative thyroid medication is natural desiccated thyroid, also known as NDT. There's a few well-known brands of NDT like Armour, WP Thyroid, NP Thyroid, and Naturethroid. This type of medication comes from animal forms, usually pigs, and contains both T4 and T3 in their natural form. NDT has been found to be very effective at providing relief for hypothyroidism patients, and it even has fewer side effects than its prescription counterparts of levothyroxine and liothyronine. The pros for this medication are, first, it contains both forms of thyroid hormone, T4 and T3. Second, it's usually much more effective for symptom relief. And third, this medication is reliably gluten-free. But there's a few cons as well. First, many physicians are just less familiar with NDT products, and so they're less likely to prescribe them. Second, certain brands of NDT do contain corn. And third, these medications tend to be less available than their synthetic counterparts due to recalls and issues of supply and demand. Now, there are some over-the-counter thyroid medication options, but that's not the topic of this video. If you want to learn about some of the options that don't require a prescription, you can check out previous videos that I've done on that topic. When you're trying to figure out the best thyroid medication for you, it's important to consider all your options from a functional medicine perspective. While levothyroxine and liothyronine are popular choices, natural desiccated thyroid might be the better option due to its effectiveness, its lack of side effects, and the fact that it contains fewer potentially allergenic ingredients. Ultimately, though, you should always discuss this topic thoroughly with your medical provider. If you enjoyed the video, I'd appreciate a thumbs up or drop a comment down below. I'd love to know where you are in your thyroid journey. And if you have hypothyroidism or hashimotos, you know that your needs are different when it comes to nutrition and lifestyle choices. That's why I've created my thyroid reboot method. You can learn more about my program by checking out my website or scheduling a call with me. I'll drop those links in the video notes. Again, thanks for watching. See you next time. Bye.